It's Tuesday, September 16th. Thank you for your patience. My apologies for us still being a little delayed. I take full responsibility. I spilled a cup of coffee across my desk. So I am Connie Mendel, the Chief Health Strategist and Director at Louisville Metro Public Health and Wellness here in Louisville. Thank you for joining us to learn more about the Suicide Fatality Review Report we released this morning. We are so fortunate to have these subject matter experts joining us today. Dr. Laura Fry, who is the principal researcher in the project. Dr. Fry is with the University of Louisville Raymond A. Kent School of Social Work and Family Science. She is also a licensed marriage and family therapist. Geneva Robinson, Director for the Crisis Information Center at Seven County Services, and Lakeisha Gardner, Suicide Prevention Coordinator here at the Louisville Metro Department of Public Health and Wellness. Our subject matter experts are going to offer some insights and information. Following that, we will welcome your questions. So I'll now turn it over to Kathy Harrison, our Communications Director.
Thank you, Connie. This is Kathy Harrison Turner. And again, I want to say thank you to everybody who's joining us. And thanks again for your patience. We are having fun with WebEx. But I'd like to ask everybody to make sure you mute your devices. Following the remarks from our speakers, we'll be happy to answer your questions. And at that time, you can either unmute and ask your question. You're always welcome to put your question in the chat. We are recording this briefing and we can make it available to you afterwards. We will also add it to our YouTube channel. So as Connie said, today we released the Suicide Fatality Review Report, and it highlights trends and risk factors in suicide deaths from 2019 to 2023. And the report also urges community-wide action to prevent suicide. So I want to start off this morning with Louisville Metro Public Health and Wellness's Lakeisha Gardner. Lakeisha, can you give us a little bit of background? How did the project and the report come to be? All right.
In 2022, our Louisville Metro Department of Public Health and Wellness received ARP, or American Rescue Plan funding. With this funding, we were able to develop the Jefferson County Suicide Fatality Review Work Group. This work group is comprised of professionals from various sectors across the city, from behavioral health, higher education, emergency care, primary care as well. The goal of the group was to look at local trends on suicide deaths, look at trends in patterns, and then develop recommendations for the city. What has been critical to this work has been our MOU, or Memorandum of Understanding, with the Jefferson County Coroner's Office, so that we were able to do some of this critical work for this report.
Thank you, Lakeisha. So, Dr. Fry, can you tell us how the group delved into the research and analysis and some of the key findings?
Absolutely. Thank you for the opportunity to share about our work. Together with a team of researchers from the University of Louisville's Kent School of Social Work and Family Science and the Center for Family and Community Wellbeing, we examined the de-identified coroner reports for lives lost to suicide that took place from 2019 to 2023. De-identified means that any identifying information was removed, yet we still had information related to age, sex, race, and ethnicity, occupation, marital status, as well as a summary of information, what we call the narrative, given to the coroner or medical examiner regarding the events leading up to someone's death. In that narrative, we might read about whether family or friends knew the individual had been struggling or for how long, what method was used at the time of death, whether alcohol or other substances were involved, or whether someone else was present at the time of the death. Our team of researchers read through the narratives, coding for specific themes to see if we could determine any patterns that might be used to guide recommendations for how we tailor suicide prevention efforts here in our community. Our findings were then reviewed during bi-monthly Suicide Fatality Review Work Group meetings that included representatives from over 20 community partners, as Lakeisha just shared. Overall, we found that although suicide deaths initially declined in 2020, Jefferson County experienced a 24% increase in suicide deaths from 2019 to 2022. A few findings that are on track with national trends. We lost more men to suicide, with the proportion of men increasing from 67% to 79% of the total lives lost by 2023. The majority of deaths were overwhelmingly among non-Hispanic white individuals, yet it's also important to note that the number of lives lost among both Black or African American individuals and Hispanic Latinx individuals doubled within that time frame. Firearm use was by far the most frequent cause of death, especially among men. And interpersonal discord, that could be arguments, fights, separation, divorce, either with romantic partners or family, friends, neighbors. That was the most common precedent mentioned leading up to a death, occurring in nearly a third of all deaths. A few findings that are especially unique to our community, those in the construction and extraction fields, transportation fields, and production fields lost the highest number of lives to suicide, while deaths within transportation and production aligned with the proportion of individuals working in those fields here in Jefferson County. The high number of lives lost within construction are concerning, given the smaller proportion of individuals working in those fields here in Jefferson County. Finally, one item that also surprised us was that at least a third of all deaths involved cases where someone was either present as a witness at the time of death or immediately preceding the loss of life, which to us indicates a need for more increased post-vention efforts to provide support for those individuals. I'll wrap up by saying, our work is not over. We continue to partner with Louisville Metro and the county's coroner's office to review the demographic data and narratives of deaths as they occur in our county, to watch continually for additional patterns that might aid our suicide prevention efforts. And I also want to extend a thank you to the Jefferson County Coroner's Office for their diligent work and their willingness to partner on this project. And I want to extend our deepest gratitude to the individuals who's lost their lives to suicide and whose data contributed to this project. We recognize the weight of their experiences, and we're committed to using this knowledge to advance suicide prevention and mental health support here in our community. Thank you.
Thank you, Dr. Fry. Geneva, I'm going to come to you because a lot has been highlighted here. Can you share what resources are available to help those who are affected by the problem, by suicides? Where are they? What's available to people? What do we have in the community that works and can help?
Absolutely can, and thank you. I'm going to highlight what is the positive part, I guess, of some of this information, because suicide really is a public health issue, and it's a public health issue that impacts all of us, whether we realize it or not. There's just so many lives that are lost in our community to suicide every year. But the beauty of that is there's also so many things that each and every one of us can do in order to make a positive impact and reduce that rate. And what we're doing here today, raising the level of awareness, helping people understand the depth and the breadth of the issue of suicide, is the first step that we can take. And the next step that I would like to highlight that anyone can take is to be able to be comfortable addressing suicide as a topic. There is so much stigma that still exists in our society around the topic of mental health or suicide. People will tell you just about anything at all about them, but they won't tell you if they're having thoughts about suicide. So we want to encourage folks to get educated, to learn more about warning signs and risk factors, so that if you see something that concerns you, you will feel comfortable to say something. And there are organizations such as the National Alliance on Mental Illness and the Kent School of Social Work, where Dr. Fry works, who can help with those educational programs such as QPR, Question, Persuade, Refer. A simple thing that everyone can learn. You don't have to be a therapist to be able to make a difference. So we want people to be able to be straightforward and honest in asking that question. Are you thinking about suicide? I'm concerned about you. And sometimes the reason that we don't ask that question and deal with it directly is because we're afraid someone's going to say yes. I have been thinking about that. And we're not really sure how to fix that or what to do about it. But what I'm here to tell you today is that there are so many resources available in our community that you don't have to learn how to fix it. What you need to learn to do is to be able to connect folks with resources that can help them where they are. And when you're able to offer somebody help, what you give them is hope. And hope is what makes the biggest difference between whether someone goes ahead and carries through on a suicide attempt or they realize that there are other options for them to feel better. And one of the options we want to talk about in our community that's available to anyone is the 988 National Suicide and Crisis Hotline. And in our metro area, that line is answered through 7 county services. And the line is answered 24 hours a day, 7 days a week, 365 days a year. It never closes. And this line offers compassionate, non-judgmental counseling to anyone who finds themselves in a crisis situation, who may be having thoughts of suicide, or have even made a plan to carry through on a suicide attempt. Our counselors are specifically trained to be able to listen and to understand how the issues of your crisis situation might be impacting you, but to also work collaboratively with you to be able to develop a safety plan to connect you to the next types of help that might be able to assist. And for this 988 line, you don't pay a penny. It's a free service that's available to anyone. They can call themselves, you can text, or you can chat. So it's available in several different ways for folks to be able to reach us. And when our counselors are working with folks to be able to connect them through 988 to other resources in the community, it may take the form of making a warm transfer to a 7 county services access line, which 24 hours a day, 7 days a week can set up an appointment for outpatient services. It may mean that we are connecting an individual to an adult or a child crisis clinic who can get them in very quickly to see somebody specifically about that crisis situation or the suicidal feelings that they're experiencing. We might also be able to connect them to mobile services through the Mobile Crisis Services team, where we can actually bring crisis assessment and crisis intervention services to individuals in the community in a place where they can be comfortable receiving that help. And in some situations, those where people maybe have already made an attempt on their life or are in the process of doing so, we are skilled and trained to be able to initiate emergency rescue services to ensure that that individual is going to be safe and stay alive. So there are all these services that are accessible and free and available to anyone in our community, and we hope that everyone will feel free and comfortable to reach out and use those when needed.
Thank you, Geneva. It's so great that we do have these important resources in our community. Lakeisha, I wanted to circle back to you before we go to questions from the media. So this is awesome, really compelling information. What is Louisville Metro government doing with the information? And are there other recommendations that we have for the community?
Yes, thank you, Kathy. The Jefferson County Suicide Fatality Review Work Group will continue to meet as we have in order to continue conducting case reviews on local deaths by suicide. Moving forward, we would like to conduct even more in-depth case reviews so that we can get access to more granular information to give us more tailored details and information regarding the deaths by suicide. For example, did a decedent happen to visit their primary care physician a couple of months before the death by suicide? That will give us more information about some of the circumstances surrounding the death. Moving forward, these case reviews will allow us to develop more tailored recommendations that are specific to our Jefferson County community.
Great. Thank you so much, Lakeisha. Well, guests, you've shared a lot of valuable information with us. I do want to open the conversation to our news media colleagues. So if anybody has a question, you can unmute. You can put your question in the chat. Paul Miles with WHAS Radio. I see your hand is raised. Do you want to ask your question?
Thanks, Kathy. A question for any of the participants. The report notes a disparity here in the suicide deaths among Black people. in Hispanics and Latinos, more than doubling during this time. What can you attribute that to?
Dr. Fry, would you like to answer that or offer response for that?
Sure. I will say, so this report that we did, we can't speak necessarily to the causality related to those deaths. We were primarily looking at the circumstances surrounding the death and perhaps factors leading up to it, but we can't necessarily speak to what the cause was in that driving trend. That is a point of exploration for us going forward to try to discover any other information that might help us tailor some of these efforts.
Does that mirror a national trend?
Yes, it does absolutely mirror the national trend. There are increases among Black and Hispanic individuals.
Thank you.
Jose, I see you have your hand raised. Do you want to ask a question?
Hello?
Hi, we can hear you.
Okay. So, what specific culturally relevant outreach or prevention strategies are you implementing or planning to implement to address these disparities?
Geneva, can you address how 988 and some of the other resources for support and prevention are more culturally appropriate?
Sure, I'd be glad to. When anyone calls 988, they will go through a national network and they will be given a choice right off the bat of whether they want services in English or whether they would like to speak with a Spanish speaking counselor. And they can easily press a number 2 and be connected specifically to a Spanish speaking counselor. Also through 988, we use something called Language Line Solutions. And this is a translation service that we can access for any of our calls. And that will give us the opportunity to talk to people in over 240 languages and dialects so that we are able to provide the services to folks regardless of whether or not they can speak any English. And it helps us to meet them where they are. So that is available for us as well. We also receive national training through the National Lifeline on culturally sensitive topics and how to address people based on a respect for the culture that they bring to the table for their crisis situation. And those are parts of our accreditation process that all 988 centers must go through.
And do you know if any of these actions do you think that are not working or have not worked, since the report shows that the increase is big?
I'm not sure who might be best here to answer that, but I do want to say, Jose, I think one of the biggest things is what Geneva highlighted is increasing people's comfort with talking about how they're feeling and their mental health. And you and our other Hispanic media colleagues play an incredible role just by being here today and helping to elevate this information. I know I will ask Ben or Lakeisha, who are our suicide prevention and behavioral health effort leaders. I believe we're making some appointments to do presentations with some of our community partners like La Casita Center. But we want to make sure that people become much more comfortable with being able to reach out and to talk about their health. Is there anybody else who wants to offer some information here?
I will go ahead and add also that I think it's important when we're increasing people's comfortability with reaching out, that all calls that come into the 988 line are confidential. You know, we're not allowed to disclose any information. And they are anonymous in almost every case. We're not going to ask for a name or a phone number or birth date or any kind of information. The only time we would ever ask any information is if we're going to be calling back to someone to follow up, and then we only need a first name and a phone number, or in in the rare case where we are initiating emergency rescue. Otherwise, this is a safe and protected place that folks don't have to worry that their information is going to be shared in some way or that other people are going to be aware that they made the call.
Lakeisha, I saw you had your hand raised. Is there anything you wanted to add?
Yes, Kathy, I wanted to reference one of our key recommendations from the report regarding tailoring prevention trainings because we know that we've seen increases in suicide deaths amongst our African American and Latinx population. We know that it's important for us to tailor the ongoing trainings that we have and any future trainings with a culturally informed lens. How can we use language that relates to the communities, the populations that are disproportionately at risk? That's one of our key recommendations, not just for the health department and the SFR work group, but for our community broadly.
Thank you, Lakeisha. That is important. I don't see any questions in the chat. I don't see any hands raised.
Kathy, we do have some questions in the chat. Give me 1 second.
Okay, great. Thank you.
There's actually one from Sarah Ladd and then from Luis de Leon.
Okay, for some reason I can't see them. Do you want to go ahead and maybe read the first one?
Okay,
Oh, wait,
so
hold it. Okay, yeah, no, I'm not seeing it. I'm sorry. Go ahead.
okay. So from Sarah, I know this research is more about patterns of loss rather than causality. I don't know if she wants to go ahead and read it, but we can anyone speak at all to some possible factors driving the data? She's particularly looking in the increase in 2022, the career-specific losses, and men being at higher risk than women.
Thank you. Dr. Fry, could you offer some insights or thoughts about that?
Sure. Whenever we were looking in the data for specific precipitating events that might give us any clue to some causality around suicide deaths, we did see, as I mentioned, interpersonal discord, having disagreements, having a loss of a sense of belonging in someone's community, whether that's through separation or divorce or conflict with children or other family members. That was a very common precipitant. Other common ones that we saw were substance use involvement, whether that was alcohol or other substances. We also saw some justice system involvement or financial losses, job losses that were also precipitating factors. Those were some of the common ones that we saw repeatedly throughout the cases. As far as specifically the numbers being higher among men, one thing that's often attributed to is there's perhaps a couple things, and I can't say this is directly related to our data, but what we see through national trends is certainly through the higher likelihood of using a firearm in a death. There's a lower likelihood of having an intervention during that time, right? A firearm is a much more higher lethal means. You're more likely to die from an attempt using that. So that's certainly a reason why we might see more men dying and that they are more likely to use a firearm in those deaths.
Thank you. I see the chat now, Catalina. I'm sorry. Thank you for backup there. Sarah, I think if you had any additional questions, feel free to put them in the chat, come off mute. I don't think, Jose, did we answer your question? Dr. Farley.
I was asking on a follow-up if you have any other specifics when it comes to the Latino community anyways, because it's very different. It could be very different in a person that just arrived here to a person that has been here 30 years,
Absolutely. That's an excellent question. Unfortunately, with the data that we had for this particular report, we did not have information related to national origin, immigration status, or any other demographics beyond what I mentioned. However, we have been partnering with the coroner's office and they are open to trying to collect more information that might be able to aid in some of those questions. So we're hoping to have more moving forward, and we're working on that. Thank you.
And one more on the KY988 service. I think it's a great service or a great tool, but would you say that when people uses that service, it's a little too late? because they are already almost in the, you know, what other measures?
Yeah, that makes sense what you're saying, but what I want to say is no. And what we want is your help with this, because we really hope on the 988 line that we encourage folks to reach out to us when a crisis starts, not when a crisis becomes overwhelming, so that we can connect them with resources so that they are able to kind of address all of the underlying issues that brought them to that crisis place. But it is never too late. As I said, we are trained in de-escalation. We are trained in making those connections. And when needed, we do have that safety net in place that we can initiate active rescue and make sure that that person stays safe. And we can do outreach calls so that we can connect with that person in an ongoing way. It's not just the one call and then hope they're going to be all right, that we can continue to check in and to make sure that they stay safe. Along the same lines, we encourage third-party calls. You know, so if you have someone in your life that you're seeing some warning signs or some risk factors and you're worried about them, we also can take that call from you and then call out to that individual to be able to offer them support and help. So it's never too late, but we encourage folks to not wait until that crisis becomes overwhelming.
Just as a feedback, I think some of the ads promoting this to me seem a little too informative, boring. They're not eye-catching, and so they eventually they become how do you say, they blend in the rest of the information we get every day. So I don't think they reach the people when it comes to, you know, this moment crisis. Maybe it needs to be a little more creative.
Thank
I don't
you.
know. I'm just
That's great feedback, Jose. Thank you for that feedback. And we can pass that along. I do want to get to a couple other questions in the chat. Luis is asking, what do we think were the factors that led people to die by suicide, especially those in unskilled jobs? I know, Dr. Fry, that you have said we can't really say causality, but are there any other thoughts or insights around that?
Sure. So some questions that came up for us that I can't answer directly from our data, but questions that came up are how aware are individuals getting the information of what services are available, right? How much information is getting to them? We also, whenever we think about quality care, we think about accessible care and affordable care. So are those things that are also available to them? We also, one of our recommendations is also wanting to work more directly with employers moving forward. Are there trainings or services or outreach efforts that we can directly tailor through their lens to also help get resources into the hand of folks? So those are some questions that come to mind for us as well.
Thank you. And does anyone know, has there any calculation been done on how much, wow, the cost of the state to lose a productive life? Well, can we put a value on a productive life? Life is invaluable. That's me, my opinion. But I don't know if we've done any kind of research around that. Is there a way to calculate that, Dr. Fry?
I do know that some people have tried to calculate, but I agree. I think that that's a really hard number to come to, and there's a lot, so many factors. I think what's more important that I like to keep in mind is certainly the impact of that life lost on those around them, and just the loss of that individual's life. Right, that's something that's such a tragic loss. So we want to do everything that we can to try to help them access care and access the resources that are available.
And to Lisa's last question, what type of weapon people who die by suicide use? I believe your data revealed just firearm was used in a large percentage.
So yeah, firearms were used in over half of deaths by suicide here in Jefferson County over that 5-year time span that we examined. Other common methods were poisoning and suffocation as well, which again is also on trend with national averages. Those are typically the top 3 methods.
Great, thank you. Sarah had a follow-up question for Geneva. You shared great information about how people can help. Can you also share some of the red flags that could indicate someone is feeling suicidal without someone asking directly?
Sure. Some of the warning signs that we ask that people be aware of are, the biggest one is a change in behavior that doesn't seem to make sense. So if you have a person, for example, who is normally outgoing and is socially connected, begins to withdraw. They're no longer participating in activities and events that they once were very much a part of. If people are spending too much time alone and they're not wanting to connect with other folks, if they're having disruptions to their sleeping patterns and their eating patterns, and that can go in either direction. It can mean sleeping too much and just not able to get up and do day-to-day tasks. It can also mean insomnia and not being able to get good sleep. Same with eating. It may mean eating too much. It may mean that you just aren't able to eat. Any of those changes in behavior are things that we suggest that folks explore, ask a little bit more about. And always, always, when people are making exclamations, talking about, well, you would be better off without me, or, I don't think there's any way anything can change. Nothing and no one can help me. Those are very strong red flags that someone has really been giving some thought to the fact that they don't see an out other than through their death, and definitely ones that we would want someone to follow up with and to reach out to get some help.
Thank you, Geneva. I don't see any other questions in the chat. If any news media have additional questions, feel free to offer. If not, I would like, before we adjourn, to ask each of you, what's one thing you want people to take away from this work and this report? Lakeisha, I'll start with you.
Thank you, Kathy. I would like to re-emphasize that this report is a product of collaborative work of the Jefferson County Suicide Fatality Review Work Group, and that suicide prevention is a collaborative effort. It deserves a community-based approach.
Thank you. Dr. Fry?
Yeah, a big takeaway is that, for someone, if you're feeling hopeless, you're feeling hopeless on behalf of a loved one, please know that there are people out there that care. And there's a lot of people, as Lakeisha mentioned, a lot of people behind the scenes believing that we can do more and trying to do more for our community.
Thank you. Geneva?
I'd love for people to take away that suicide is preventable, that we all have a role that we can play in addressing this public health issue, and that there is, as Dr. Fry said, hope out there and help, and you're not alone. Whether you're the one experiencing the crisis or it's the crisis experience of someone you care for, we're here, we want to help, and help is just a phone call away.
Thank you. And Connie, any last words from you, our Chief Health Strategist?
First, I want to thank everyone that participated in the call today. Just echo that this is absolutely a community issue, and it's going to take all of us working together to solve it as a community. I encourage everyone to review the report, look at some of those trends, see if you can see yourself, your family, your coworkers, and act. Let's talk about it. We have to talk about this as a community.
Great. Thank you. That's it we have for today. If any of you need a recording of the briefing, just reach out. I'm happy to share the recording with you. You can also follow up with me if you have any other follow-up questions. Really appreciate your time today. Thank you again for joining us. Thank you, Dr. Fry, Lakeisha, Geneva. Thank you so much for being here. And thank you to our media colleagues for being here and elevating the issue. Everybody have a good day.